Welcome back to the Hard Hustle Podcast. Our next guest, Dr. Raymond Garcia, that says, listen, at some point I realized medicine wasn't just science, it was storytelling and healing. So, Dr. Raymond, Dr. Garcia, what do we call you here, by the way, before we continue?
Dr. Raymond's fine.
All right, Dr. Raymond. So, listen, you say you realize that it wasn't storytelling or it was storytelling. When did you realize that?
Yeah. A big part of what I do as a psychiatrist is really hear and listen to people's stories. So as I really got into the swing of practice and heard more and more stories, it became, really evident to me that that's an important part, a really important part of knowing how to help people is to be able to listen to their stories and learn from it, and then that's where you kind of hear the real message of what's really going on with them and what do they need, how can you help. So it was really as I just continued to practice.
Do you remember these moments as you were growing up that you thought you had to choose between science and also being creative?
Oh yes, very much so. Because as much as I loved science, also there was this very creative drive in me as well. I mean, one of my considerations for career was to be a writer, to maybe go into screenwriting or something like that, and entertainment field, because I wanted to create. And but that was kind of the happy accident, if you will, that came along with practice was as I discovered the storytelling aspects of practicing psychiatry and addiction medicine. It allowed me to use that creativity as well, in my practice and in working with people.
Tell to the listeners, what are you doing today? What is your title currently in the organization that you're with?
So I am Chief Medical Officer for Rosecrance Behavioral Health. We are a comprehensive program that offers treatment for mental health and addiction medical problems. So for people with
Okay.
mental illness, people with addiction issues, substance use disorders, we provide both residential treatment and outpatient services as well in the Midwest.
Amazing. What do you think your younger self, doctor, would think of you and the man that you become today? We talked about the early days, but now that you're in it, you're living it. What do you think your younger self would say?
Oh my gosh, my younger self would not believe it. My younger self would be really, I think, kind of in, uh, you know, I don't want to say in awe, but maybe really surprised, because my younger self was a very, very shy, very, not the kind of person that would, that would be on a live on a podcast like this.
I was gonna say that, yeah.
I was that my younger self was the kind of person who kind of stood to the background a little bit, and but certainly had aspirations, and would look from the sidelines and be, I wish I could do that. So my younger self would be, yeah, I think really surprised, but also probably really happy to
hmm
see
hmm
where they've gone.
Talking about happiness, one of the things that you mentioned to me was that it's more than a paycheck, right? You said it means more than a paycheck. What's a moment that really drove that home for you?
Yeah, yeah, certainly more than a paycheck. It's about it, not to sound cliche, but it's really about helping people and helping more
Mm,
people. And it's that, it's that moment when, you help somebody who then comes back and tells you at some point, thank you. You really made a difference. I mean, when somebody tells you, you saved my life, or you made that difference. You helped me make that right choice. Those are the moments that really, make you want to keep doing what you're doing. Those are
yeah,
the rewards. So,
yeah,
yeah, the
yeah.
first time you hear something like that is really powerful.
Yeah, I'm a big believer that life is not even about us, right? It's about others at times. And of course, taking care of ourselves is highly important, mental health, all that, some of the things that you guys really work on. But I think as a human being in these spaces and being blessed with the opportunities, that it's not about us. It's a passion, it's a purpose. We mentioned it's not about the paycheck. And I love that. And I love that you also still see patients. I think people may not know that, but why not hang up the white coat and go for executive? I think you can do that, right?
Yeah, sure, you can. And, there are people who choose that path, and that's the right path for them, but not for me. For me, continuing to see patients helps keep me grounded. It helps keep me my pulse on the beat, of current practice. It keeps me fresh, but also there's that connection part of it. It keeps that part of practice alive, of maintaining that human connection, getting that feedback from patients. That reward. I don't want to let go of that.
Mm-hmm. Mm-hmm. No, for sure. When you just love it, you love it. When it part of, does it still feel like work to you actually?
Of course, any job, can feel like work sometimes, but no. I mean, most of the time, this is, actually, a lot of psychiatrists will tell you that, a lot of psychiatrists will tell you that they enjoy what they're doing so much that they don't even think about retiring.
I love it.
The people that I've modeled myself after, my mentors, I know many of them who worked well past retirement age, because they love what they do. And I'm discovering the same thing. It's just, it's a joy, to be, and a privilege to be able to do this.
That goes back to that passion, right? Like you have so much passion that you don't want to hang up that coat either.
Yeah.
So I love that you're there. You talked about, kind of go back earlier, science and creativity. Where do they actually show up in how you choose treatments? Because I think there's both that play a part in that.
hmm Well, yeah, certainly, of course, there's the science in terms of the more we learn and discover about the brain. That is the really interesting part of it, of the science, and learning how things work. And how can we, enact change, or induce changes in the brain to help people
Hmm.
to change their behavior for the better, for the positive. But then there's also that creativity that comes with, again, listening to the stories that people tell you, to be able to help figure that out, because it's not just about symptoms. It's not just about,
Yeah.
what's the heartbeat, what's the, rate of breathing, what's the temperature. It's about what's going on in somebody's life that can give you that clue,
Hmm.
those clues into, okay, maybe that's what's contributing to these behaviors that are maladaptive. And then choosing treatments, there's an art to that, there's a creativity to that, because as much as we're learning more and more, there's a lot we don't know.
Yep.
If you look at the mechanism of action for an antidepressant, the first thing it'll say is, we don't know exactly how these things work, but these are the theories. And so, with that comes uncertainty. And so you have to be
Hmm.
creative in terms of, figuring out what are the right, combinations, or choices for treatment options for people.
Such a good space to be in for you. One thing I really want to talk about creativity is I remember growing up thinking a creative had to be an artist, and now I'm a little older. I'm like, we're all creative in our own ways, and what you're doing,
Yeah.
right? You get to really bring that creativity. I don't know when you found out that creativeness was in all of us. It wasn't just being an artist, but it is just so cool when I hear what you're saying and how you love the science, but you also love the creative side of it and how you kind of mix them in. And I can imagine that you possibly also have patients that come in thinking they've tried everything. And that's where the creative juices really start flowing, because now you really got to show them, like, wait, we're here to show you that there's still something that truly works. You just got to find those pieces. And then everybody's a little bit different as well, correct?
Absolutely, absolutely. I firmly believe that in behavioral health science, we're in the business of selling hope.
Mm.
Because that's what people need to go on. And yes, we can be creative. Maybe you think you've tried everything, but there's often something else. There's some other, either. I mean, there are definitely newer treatments that are coming, that are in the pipeline, or that are coming online, rapidly these days. But also there are different ways of looking at things. Maybe, maybe you didn't get the right diagnosis, or maybe there's more going on. Maybe somebody else didn't hear that part of the story for you that now we're hearing, or maybe you weren't ready to tell it, and now you're ready to tell it, and so that helps us to understand even more, and that gives us, better, better treatment options.
Yeah, and then when you talk about like a different, like maybe this person had a better experience with someone else or vice versa, it goes kind of back to, I think, experience. And we're in a space right now where experience is changing a lot, I guess, in this space,
Mhm.
possibly because of the AI. Are you guys using AI, to, for, I know some people are using it for like note taking. Is there other ways like for communication? What does that look like nowadays when there's so much AI as well, where we're getting people to probably go and use AI than actually reaching out to a real person? I think there's so many different ways we really can kind of dig this conversation. But if we can kind of just start, where are you guys at the AI space?
Okay, absolutely. First of all, I'd like to, define AI in terms of what it means to me, what it means to our organization. We
Mhm.
prefer to look at AI as augmented intelligence, not artificial intelligence.
Okay.
With the idea
Yeah.
that it is a way to enhance our abilities and our skills. It's a way to help. It's another tool. It's not something to replace. So we are, like you said, we're using it in terms of documentation. We're just getting into that. I myself have been piloting that use of AI for the past year or so now, to help with documentation. But also we are, starting to learn how to use AI to analyze data. How can we use AI to get people to services quicker? How can we use AI to help with, reviewing records, and pulling out the really necessary information, so that, we can get people the help that they need. Whether it's in terms of helping us make treatment decisions, or maybe even helping us get payers to approve treatment.
I love that.
That's another use case. We're also learning how to use AI for education purposes. How can we supplement our educational offerings both to our staff and to our clients, to our patients, by helping AI that can aggregate information, and help source information so that we can provide better educational offerings.
Mhm.
There are many ways that
I love
AI can
that.
be used to
Yeah.
enhance, to augment, the
Augment. No, I like that too, and I love that you put it that way because it really kind of shows why it does matter, right? In reality,
Mhm.
and I love how you guys are thinking about it and really allowing AI allow you to be more human with a patient. I think all these different things you're talking about allow you to just be really in tune with what that experience looks like. Because let's be honest, I think that's one of the biggest things people also hate about visiting a doctor, right? Is that experience that you have. It's not what it used to be, where it was that family doctor that knew about who truly I was. And even for myself, I think I had a visit recently, and I thought to myself that this lady did not know anything about me. And when I actually said, "Hey, you met my wife last week," and she's just like agreeing, and I'm thinking like, "Oh, you're having a conversation," because that's who I am. To find out that was even the same doctor. She was just saying yes because she was just kind of going with the motion, right? Asking the questions.
Mhm.
But it's the experience. How did I feel now that that lady really wasn't authentically being herself? Not because she didn't want to,
Yeah.
but ideally it's just kind of the system that it plays. And I think with a lot of this augmentation, as you mentioned, we could really do more of the things that we love and let a lot of these repetitive tasks, and the smartness behind it all, really, when you get to feed it. What is one of the biggest things you learned about AI and how to use AI? Because I think that's where people also have this fear, is like they just don't even know where to start.
Yeah. Yeah. I mean, even just with that documentation piece, I mean, by allowing, the AI to worry about the documentation piece, I can focus on you, the patient. I'm not sitting here typing on my screen or writing notes. I'm listening to you and, hearing you and remembering who you are, remembering that I met your wife, rather than,
Yeah.
just typing it away and forgetting about it.
I love that. No, it's definitely a game changer. I'm enjoying it. I was one of those that my friend told me about AI, ChatGPT years ago, and to me it was like anything else, like all right, whatever. And then maybe the last 2 years really tapped into it. And I'm like, wow, what a game changer! And
Mm.
now understanding the conversation more, seeing when people don't use it. There's still people that do not use AI. Like my mom, I was telling her one day about ChatGPT. I said, "Mom, do you use ChatGPT?" And she's like, what? And I say it again, and she's like, what is that? I'm like, just never mind. Like, and not that they don't use AI. Everyone's using AI because it's on their phones. They
Oh,
just
yeah.
don't see it as
Yeah.
AI.
You just don't know
Um,
it. Yep.
hell, when you talk to, I have a friend. I don't know if maybe your house is like this, doctor. You have Amazon and Siri all around the house. Alexa, actually, is what it is. Alexa.
Yeah. Yeah.
I go to my friend's house and he'd be like, Alexa, turn the light green, or Alexa, turn this on. And I'm like, oh my God, that is AI at its finest, you
Mhm.
know? I'm not there. Yeah, I'm not there. Do you have that at your house?
I have a little bit of it. In fact, I was on vacation recently away from those things, and I was just joking with my partner and saying out loud, "Alexa, what's the weather today?" And she would laugh.
That is funny. No, man, so many people really just live off of that. That is hilarious. What do you say to young clinicians who are kind of burnt out before they even begin? I think that's also something that's been kind of going around.
hmm Well, I think it's important to just, first of all, remember remember why you're doing what you're doing, right? I mean,
The
yeah, it
why.
can be very easy to get burnt out by all the peripheral stuff, the red tape, policies, et cetera. Remember why you're doing what you're doing and who you're doing it for. You're doing it for your patients, right? First of all, because you want to help, and then you're doing it for yourself for that satisfaction of making that connection and helping people. Altruism is not pure in the sense that you're not purely doing it for somebody else. You're doing it because it makes you feel good,
Yeah.
also. And yeah, I think it's important to stay grounded. Why are you doing what you're doing? Start with that,
Why?
and that is never going to change.
If the Hard and Hustle podcast has ever sparked any idea or made you think differently, do us a favor. Make sure to guys share this, post it on LinkedIn, or even text that nonprofit friend that you just have. Whatever works, this is what keeps the conversation going and allows us to just grow this community together. Seriously, we appreciate you. Yeah, the why is big. And I know you mentioned your why a little earlier, which is why you said you would not just drop the white coat and do the executive role. But let's say CEO roles opportunity comes. Are you thinking about it, or what you doing there at that point?
No, 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 no. That is not the space for me. I respect, the people who are in that role, and I certainly appreciate them. But that is not for me. That is more, kind of outward facing. And I mean, like I said before, I'm surprised that I am where I am, being able to, interact with people at this level. But that's a whole another level of outward facing interactions that's just not for me. I'm good here, and plus, I prefer to stay, with the clinical, expertise. That's where my expertise lies, is in the clinical realm. Working with people, working with medicine, working with the science, as opposed to the operation side of things. I mean, there's some of that, of course, that I have to do, but it's not my main focus. It's my main focus is still working on, how are we helping people from a medical perspective.
I love that. Is this what you wanted to do? Like even leaving high school? Like this is where you wanted to be at? This space?
I wanted to be a physician, that's for sure. I did not know back then what kind of physician.
Got it.
But as far as getting to this level, as far as leadership, that hadn't even entered my mind at that point. My main goal then was, I want to be a doctor. I want to help people. What does that look like? And figuring that out. But yeah, it's definitely been quite a journey, quite a ride, and it's been fun. I'm the kind
No,
of
for
person
sure.
that says yes. I'm the kind of person that, a challenge comes along and I say yes. And somehow work my way into yes all the way up to this position.
That's it. That's work ethic. Nowadays, it's not easy to find someone like this. Okay, Raymond. So you have the work ethic that we people look for. When I think about what you just mentioned as well, though, just kind of doing it because you knew you wanted to do it. Leadership presented itself. Thinking want to be a doctor, and in reality, being a doctor is a leader, right? You still have to. There's things that you have to lead. What are some of the things when you talk about leadership that you live by? So if you're talking to those young individuals, if you want to give some leadership tips and advice, what does that sound like from Dr. Raymond?
Okay. Well, I've definitely learned a lot about leadership, as I've, gone through different levels of it through the years. Um, I think it's important to lead with compassion, to lead with grace. I think it's important to be an active listener. and not just a speaker. You don't want to be the kind of leader who's going to be in the, at the meeting doing all the talking. I think it's even more important to do more listening so that you understand what's going on and where your staff is at, what the people you get to supervise are at, and then that gives you, the kind of information you need so that you can lead more, more effectively and efficiently. Also, I think as a leader, it's important to also be willing to, don't forget where you came from. Be willing to, to get down in the trenches when you have to. There are times that come up when, whether it's staffing issues or, whatever, emergencies, et cetera, you have to learn how to still get your hands dirty. You never ask somebody to do something that you are not willing to do yourself. I think that's really
That's a
important.
lesson. That's a good one right there. That's actually a really good one. That is 100%. So I'm gonna flip this a little bit and say we all learn from good leaders and bad leaders.
Mhm.
What is one thing you learned from a bad leader that you still recall to today?
Probably the biggest thing is ego. To lead with ego. When you're leading with ego and you're making it all about yourself, then I don't think anybody benefits from that. Not even yourself in the long run.
Yeah.
So I think as a leader, it's really important to get ego out of the way, get yourself out of the way, get out of your own way.
That is true. A lot of the times, that's what stops someone from being successful, in a sense, as you mentioned, is that ego, getting out of your own way. See it all the time, whether it's entrepreneur, whether it's in the corporate world. Really, why sometimes I hated the corporate world, man. I loved it. I love to scale, 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 and then when you get to that point where you're kind of going up against someone with that ego, you're like, this is not for me. So I hear you. That's actually a really, really good one. As we kind of start to close up, man, when we talk about the organization, is this something that is local? Is this something that you guys are nationwide? Like, we can kind of talk about that location wise and some more of the services. So as we start to wrap up, people know exactly where to reach out,
Yeah.
how to reach out.
Yeah, actually, yeah, we are a Midwestern organization. We started out in Rockford, Illinois, but we have expanded our presence throughout Illinois. We go as far south as Champaign. We have an expanding presence in Chicago.
Nice.
We also have a large presence in Iowa, a growing presence in Wisconsin, and we plan to expand to Indiana very soon, at least starting with the border to Illinois. So yes, we're
Nice.
a Midwestern company, but we're growing.
I love it. I love it. And then if they can find you socials, what are the website? Are you guys on social?
Yes, yes, rosecrance.org. You would find us. And that would lead you to all of our programs throughout the, three current states that we're at and growing.
How many locations is that through three states? Is it just one
Right now,
location per state or?
if you count all the locations, different sizes, et cetera, we are, I believe, we're above 70.
Wow.
Yeah.
And how long you been with them? You seen that grow from like the start, or what did that look like?
So I'm in my 16th year working full time for Rosecrance. And when I first started, we were just in Rockford. We were a small mom and pop organization, and now we're a company of well over 1,800 employees.
Oh, you've had a lot of fun there, man.
Oh yeah, yeah.
I love
It's
it. I
been
love
fun,
to see those
seeing
kind
it
of
from the
growth.
ground up for sure.
And to see that you're still happy. Obviously, the culture has been created really well there, because that's huge. Culture in a place where you can be there that long, still have the same kind of love.
Oh yeah.
Someone did a really good job.
And I'm not alone in this. I mean, I have, fellow leaders who have been here, who have grown up here. Our CEO, has been with the company for 30 years. So,
Wow.
yeah.
Oh yeah, you guys are legends over there, man. You guys are doing it up. Well, listen, now I'll leave you with this blind question is what we love to do. If you couldn't be a doctor tomorrow, what would you do that still helps people? Because that's what you love to do, right? You love to
Yeah,
heal, help
yeah,
people.
sure,
So what would
sure.
you be doing?
What would I be doing if I couldn't be a doctor? Hmm. I think it would be cheating to say if I could be a counselor because that's almost a doctor.
I mean, not really, not really. I guess it's kind of a little different there. I love it.
I would try to figure out a way to use my skills, like maybe, in a way that's more behind the scenes. Like, can I work, in some place where, you're developing, programs and policies that, are in the same space, helping out, how to run a program, so not as active, or, or maybe, I mean, I think stories, we started out talking about stories. I think stories help people. Maybe I'd go to that and explore that. That was where I started. Like, when I was growing up, was thinking about being a writer, right? So maybe I'll start writing and figure out, how to do some writing that may be, helpful to people.
Dr. Raymond, we're gonna leave it on that. I'm an accountability. I love to be an accountability partner. You said writing a book. You still have time. You're still young. So at some point, Dr. Raymond, I'm looking for this book. I'm just saying, okay. You got time. You got a little bit of AI.
Oh yeah.
And you have this passion of creativeness. So and I can imagine there's so much that you can talk about. But Dr. Raymond, thank you so much for your time. Truly an honor to just have this time here with you to learn more about your organization, more about yourself, and the leader that is a part of this organization. You mentioned huge organization with so many great leaders, and you're just a part of it. So thank you so much. Guys, if you guys are still watching, make sure you do like, subscribe, and comment. And we'll catch you on the next one. I'm
Mhm.
Efrain. This is Dr. Raymond.
Thank you.
Cheers.
Bye bye.